back to the show. October is Breast Cancer Awareness Month, and here to talk to us about prevention, early detection, and treatment is Dr. Nancy Chan. Doctor, welcome to the show.
Thank you
so much for being here.
Great to be here.
Okay, so breast cancer is the most common cancer among women in the United States. What are the most common risk factors?
Sure. So about 10% of breast cancer is related to familial risk, like BRCA1 or 2 mutation. The rest is actually multifactorial. So smoking, for example, alcohol, all contribute to increasing breast cancer risk. Also, higher breast density is another risk factor. And there are modifiable risk factors as well in lifestyle.
What are some of the warning signs and symptoms?
Right. So being familiar with your normal baseline of your breast is really important. Noticing changes like a lump that you may feel or change in your contour of the breast. If you're familiar with how your breast looks, then you'll notice it. Other times, if there's anything that you notice doesn't feel right, or maybe the breast feels a little bit heavier, talk to your doctor about it.
What are some of the preventative steps that people can take to prevent breast cancer?
Right. So I do recommend monthly self-exam, and I have a few tips on how to do it. So you start by looking at your breast first. Stay in whatever powerful position that you have,
Right.
because this has to be a positive experience.
Sure.
This is self-care, right? And just look at your breasts. Notice the changes and the differences in your normal breast. Some women may have one breast that's a little bit larger than the other, and that's your normal baseline. And then start by using the pads of your fingertip, because there are lots of sensory nerve endings, and you can go grid-like, so up and down and then across. Or you could pretend if the breast is the face of a clock, you can go from out to in and go section by section. Be systematic about it.
And how often is that? You said once a month?
Once a month. It doesn't need to be more frequent than that, because that's really how much you need to know your breast tissue.
So what happens if you suddenly discover something that feels irregular? Do you go right to a mammographer? Do you go to your OBGYN? Like, what's the protocol?
Right, whichever doctor is examining your breasts regularly. So that could be your primary care doctor, it could be your family doctor, or GYN. And then from there, they may order breast imaging, like mammogram or ultrasound, or both.
What age do you recommend starting the mammograms?
Without risk factors,
Yes.
generally we recommend 40, and that's
Okay.
once a year. For women who have higher risk, it may start a little bit earlier.
And are there any new techniques?
Breakthroughs?
Breakthroughs. I still, every year when I get my mammogram, I'm certain that it had just happened 3 weeks ago. It's like the
Right.
mammogram time of year is like,
Sure.
it flies by in the tick.
Right.
Any new devices, any new techniques in mammography?
There definitely is. I want to rally a little bit for mammogram because it's made such a difference in changing the landscape of breast cancer. Since 1970s, we started screening breast cancer, and deaths from breast cancer have been declining steadily.
Great.
So that part of it is detecting it earlier and curing more breast cancer. But we do have newer technology. We're leveraging AI to interpret the mammogram so that there are less callbacks. That's really important. We're working, clinical trials are studying actually diffusion weight imaging. It's an MRI without contrast. So using how water molecules diffuse to create contrast and get an image of that, of the breast tissue in that way.
Thank you so much. This is such important information. We really appreciate it.
Really appreciate you
Yeah.
being here.
Happy to
More
be
on
here.
tips on breast cancer prevention and early detection from Dr. Chan when we come back.
We're back with Dr. Nancy Chan, and she's discussing the importance of breast cancer prevention and early detection. So what are the new, and are there any new and cutting-edge treatments that people should know about?
Right, so a lot of new agents are being studied in clinical trials right now. So if you talk to your doctor and you have the breast cancer diagnosis, ask them about clinical trials. But there are a newer class of drugs that are more targeted therapy, so we're moving back slowly from chemotherapy. There are studies that are identifying, for example, lower genomic risk patients, and those patients who we used to give chemotherapy actually don't need it. There are new classes of drugs being developed as well.
So if given the option, people should want to enter a clinical trial.
Yes, because it would give you access, early access to newer agents. Yep.
Women living with breast cancer, what's the best way they continue to take care of themselves?
Right. Continue to exercise if it permits. Eating a very healthy diet balance with less processed food. All of those things actually contribute to their well-being as a breast cancer patient.
Yeah, I think people underestimate the power of your diet
Yes.
when recovering from cancer, but it really is like very essential.
Right. Right. Your diet and how active you are help you tolerate treatments better too.
Well, we really appreciate you
Thank
being
you
here.
so
This
much.
information is so important. Make sure you head to our website for more of Dr. Chan's information. We'll be right back. Thanks again.
Now